The network delivery is a further step up, however. Here, government agencies join forces to manage specific cases and the service delivery from different agencies. This usually requires quite elaborate public service agreements between agencies, and case management is an essential feature. One of the places that we were most impressed by was Strengthening Families in New Zealand, which is a combination of national and local agencies which come together, agree a service plan for a citizen, a case manager is identified for each, there are follow-up meetings involving that case manager, and an overriding supervision by a governance and operational section which makes sure that the various agencies at the various levels are actually contributing to plan. It's impressive. What's happened in New Zealand is that because of this joining up, they are now able to resolve many family issues and very complex problems, usually in less than a course of a year, where in previous times citizens, families could be dependent upon the state for many, many months beyond that. And finally, joint delivery. There are not very many joint delivery cases, but this involves where separate agencies come together to create a real or virtual single agency. It involves significant change in which those agencies separately have been working to create a unified protocol, a unified way of working within the new agency, and represents a very high level of integration. There aren't very many of these. We only found two, and the one that we were most impressed by was the Norwegian Labor and Welfare Organization, which was the merger of national insurance and employment services at both national and local level, where a coordinated, holistic support is given to agencies focused on the municipality in which the citizens live, but drawing on the national support of agencies within Norway. The local offices, telephone systems, internets, and specialist services have all public service agreements linking them with our local partners and with agencies. So if this one is so good, if this one is so cool, excuse my Americanism, this is so cool, why doesn't everybody do it? Well, everybody doesn't do it because, first of all, you've got to choose the right model. You don't need joint delivery if you're giving people hunting licenses. You don't need joint delivery if you're providing fairly simple and basic service transactions. The appropriate model for integration depends upon the needs with which you're dealing. And in our study, we found that the most important factor determining where you should position your agencies on the path to integration is around outcomes and the complexity of need. The range of need, how many agencies would be involved in dealing with that problem, the frequency of the interaction, the nature of the interaction. Are they merely transactional, or people fill out a form and get a license, or are they about guidance and coaching and advice and supervision, and the level of professional expertise involved. And you can see that when you consider those four and you consider the Norway case, that there's a very high level of need and very high level of complexity, and so they would move to the joint delivery pattern. Whereas others, where there are what you want to make available is a readily accessible access to a number of transactions, as in your own citizen shops, it may not be appropriate to develop joint delivery. So the first step in beginning to decide how far you move up the integration path is to gauge the complexity of the outcomes that you're serving. It is a waste of resource and effort to develop joint delivery services for very low levels of integration because of the low level of need. On the other hand, developing very low levels of integration, like shared information, when citizens are presenting really complex needs, like the families in New Zealand, may not be going far enough. The question is, from wherever you are now, can you go the full way? Can you start from wherever you are today, usually in separate silos, and move to the level of integration that you think is most appropriate for the citizens you're serving? And what we found in our research is that the question is no. And it's no because there are four things that stand in the way. Governance of the multiple agencies, performance management of agencies that can sometimes have very different and conflicting roles. Workforce change, which I think is one of the most difficult and underestimated of those that we confront in integrating services for citizens. And information sharing, particularly where agencies have developed legacy platforms that are of different configurations and different architecture. I won't go through these in detail, except to say that in the report and then on the website, we identify for each of these four the scale of the challenges and the facility that you need to manage it. Only to say that in taking a decision about how far you can move up the integration path, you must assess your own capability in being able to overcome these obstacles. Do you have leaders who can develop the integrated governance structure that you require? Do you have missions and goals in organizations which are compatible? If you do not, then trying to move too far up the integration path will result in failure. You must work to overcome these obstacles. Now, I've identified these four, and for each of the four, what needs to be done. But let me just stick here with a minute with this one, which I said was the most difficult. Most professionals in Europe work in public service. Doctors, nurses, lawyers, engineers even. Most professionals work in public service. And those professionals have very strong ethos, very strong ways of working. And even within a particular industry like healthcare, you can have many professionals like doctors and nurses who really don't like each other a lot all the time. To pretend that we can bring these professionals together, to work together in a way which respects the ethos and practices of all those professions and yet mold them all into an integrated and common way of working for citizens is silly. And to its credit, that's what New York City decided. In Health and Human Services, they are dealing with a wide range of professionals. Two of them, police, who are frequently the first call of when something goes wrong in Health and Human Services, and social workers won't even talk with each other. Social workers think that police make people who are welfare recipients criminals, and the police think that social workers are fuzzy, wet people who just try to protect the bad guys. And so they won't collaborate. In New York, they thought moving too far up the integration path, where we force these professionals to work together now, would result in disaster, not just in their organizations, but result in disaster in the delivery of services for citizens. And so rather than moving from the current silos that they've got all the way up the path to the joint delivery that they want to achieve, they decided to take just one step. Take the first step. Integrate information. Show the social workers what they could learn and what they could do better if they had access to what the police know. Show the doctors what they could do and what they could practice better if they had the information, if they knew what the social workers know. It is not a transformational path. It is an evolutionary path. And it is one that recognizes that you have the mandate to protect the ethos of the professionals who are serving for you to serve citizens, while moving toward the kind of holistic response that citizens want from the professionals that you employ. So this assessment of whether you've got the proper governance arrangements, whether you've got the proper performance management systems, sometimes these can be very incompatible. One performance management system might be based on assessment of outputs, while another one is based on an assessment of outcomes. People working together have to believe that they're being held to account for the same kind of performance. And right through to information sharing and the kind of platforms, the kind of architecture that you've got between agencies and whether you can build those. Your first job as a leader of integrating services is to assess the scale of the challenge you face and whether you've got the capabilities to meet that challenge. If you do not, then you might want to take a decision more like the New York City decision. of using a first step to begin to overcome some of those challenges, rather than pretend that you're powerful enough at this stage just to force the change through. We think that with this kind of assessment, with this kind of strategic thinking about how to move toward providing holistic services for citizens, agencies can reduce the effort and provision, they can enhance effectiveness as well as efficiency, they can, as your own citizen shops do, simplify the interactions and reduce the cost to serve, but they can also reduce the cost to be served. And we should not be coy about that. When we deliver benefit for citizens, we should be telling them about that. No private sector company would get away without boasting of their achievements. What you've done through Citizen Shop and Popo Tempo and what these other centers have done is really give the benefit and public value that citizens are wanting, and we should applaud that. And finally, and I think most importantly, you can improve outcomes by tackling complex needs in a coordinated manner. The final thing I'll say about this is this. In the 21st century, the relationship between government and citizens is no longer a relationship of transactions. It's a relationship of trust, either strong trust or poor trust. The better that we deliver public services, the more we listen to and engage citizens and educate them so how they can act on their own behalf, the more that we're accountable and transparent, the more we focus on their needs, the more we build trust. And if citizens trust us, they are more willing to play their part. As this citizen in our Global Cities Forum said, it's not just that government should do more, but they recognize that they should do more too. It's our obligation to deliver services in a way that builds trust and enables citizens to become more active in their own welfare. Thank you very much.